My name is Jones, and today we are going to look at the classification of drugs. Okay, this is Unit 4 in our series of comprehensive study of PowerPoint and notes in pharmacology. Okay, so I welcome you to this lesson, and if you have not listened to other lessons within this compilation, I urge you to listen to those notes unit by unit. Okay, so that you can know where we have come from and see what we have covered. The general objective of this lesson is that by the end, you should be able to acquire the knowledge and understanding of classification of drugs. The specific objective of this lesson is that you should be able to describe the classification of the following drugs, that is analgesics, antibiotics, antiviral agents, antifungals, antiprotozoa, disinfectants, or antiseptics. Okay, so let us now start looking at classification of drugs. A drug is a mixture of substances used in the diagnosis, cure, and in the prevention of disease. Drugs are classified according to the properties they have and the types of disease-causing organism that they target. When you know the classes of drugs, you will have acquired the knowledge of how to treat condition accurately. Hence, you will hasten the treatment of the patient and subsequently save lives in time. There are many classification of drugs, but for the sake of this study, we have categorized six main classes of drugs. So we have one analgesia, okay, as the first class of drug that you're going to use. Okay, then two, we have antibiotics. Three, we have antiviral agents. Then four, we have antifungal drugs. Then five, we have antiprotozoal drugs. And six, we have disinfectant or antiseptics. So now we are now looking at analgesic drugs. Analgesia is any member of the group of drugs used to relieve a pain due to several causes. So okay, that is the absence. Algesia, sensation. So you want the absence of sensation of pain. So analgesia is any member of the group of drugs that are used to relieve pain due to several causes. They are divided into three subgroups, namely analgesia used to treat mild, moderate, and severe pain. So we have three subgroups under analgesia: for mild treatment of pain, for moderate treatment of pain, and severe treatment of pain. However, you must know that there are two primary types of analgesia. We have narcotics. These are opioid-based analgesic drugs. And then we have non-narcotics or non-opioid drugs. These are analgesics that are used to treat the above types of pain. So mostly when you're talking of non-opioids, you are talking of non-steroidal anti-inflammatory drugs or NSAIDs. Okay, so types of analgesia. So we have narcotics and we have non-narcotics. Examples of narcotics include morphine, codeine, and pethidine. Then examples of non-narcotics include paracetamol and non-steroidal anti-inflammatory drugs, abbreviated as NSAIDs. Okay, for instance, aspirin. Okay, so narcotics, they are used to treat moderate to severe pain. Okay, so when you want to treat moderate to severe pain, mostly the choice of drug will be narcotics. Okay, severe pain, someone who's just from theater, you may use narcotics within the critical hours after the patient has come from theater. Then for non-narcotics, these are used to treat mild to moderate pain. So types of analgesia, we continue. So these drugs are classified like this because of the way they act to elicit an effect in the body. You also need to know that narcotics, okay, they may cause a sedation, okay, whilst non-narcotics may not cause sedation. Okay, non-narcotics may have antipyretic effects, whilst narcotics do not have antipyretic effect. Okay, so non-narcotics, they have most of them they have good anti-inflammatory properties, whilst narcotics may not have good anti-inflammatory properties. So those are some of the things that I felt I should know about these drugs. So the primary differences here being discussed about narcotic analgesics and non-narcotic analgesics. So narcotic analgesics, they act as centrally, whilst non-narcotic analgesics may act peripherally. Narcotic analgesics may cause addiction or dependence, whilst non-narcotic analgesia, they may not cause habit forming. Okay, when we talk of narcotic analgesia, they are found under the Schedule 2 and 3 of controlled drugs. When you talk of non-narcotic analgesics, they are not controlled drugs. They are what we call over-the-counter drugs that you can even just buy. Notable adverse effects amongst narcotic analgesia include sedation, respiratory depression, and breathing problems. When we talk of non-narcotic analgesia, notable adverse effects include gastric irritation. When you talk of narcotic analgesia, they have no anti-inflammatory effect. When we talk of non-narcotics, they have anti-inflammatory effect. Okay, so those were the primary differences. So opioid analgesia relieve pain by acting directly on the central nervous system. Opioids are derived from or related to the opium. They bind to opioid receptors, which are present in many regions of the nervous system and are involved in pain signaling and control. Non-narcotics or non-opioid analgesia have principally analgesic, antipyretic, and anti-inflammatory action. They act primarily in peripheral tissue to inhibit the formation of pain-producing substances such as prostaglandins. Non-opioids do not bind to opioid receptors and are not classified under the controlled substances. They are milder forms of painkillers. Okay, paracetamol has analgesic and antipyretic properties, but no anti-inflammatory properties. Non-steroidal anti-inflammatory drugs, NSAIDs, are a group of drugs that have the capacity to induce analgesic, antipyretic, and anti-inflammatory effect. Please kindly note that paracetamol does not have anti-inflammatory properties. Okay, but when you're talking of non-steroidal anti-inflammatory drugs, most of them, if not all of them, they have antipyretic, anti-inflammatory, and analgesic effect. Okay, now the mode of action of non-narcotics. Okay, so the mode of action of non-narcotics is that cyclooxygenase enzyme catalyzes the conversion of arachidonic acid to endoperoxide, which result into production of prostaglandin and thromboxane. Okay, so this one you can understand it more nicely in a diagrammatic form when we try to illustrate that within our board lessons. Okay, so it's cyclooxygenase. After an insult or an assault to the tissue, it's cyclooxygenase enzyme that is going to catalyze that from the word catalyst. So it's going to catalyze the conversion of arachidonic acid to endoperoxide, which then results into the production of prostaglandins and thromboxane. So these vasoactive mediators are responsible for pain and inflammatory processes. The cyclooxygenase enzyme, inhibited by NSAIDs, were discovered to have at least two different versions. So we have a cyclooxygenase 1 and the cyclooxygenase 2, abbreviated as COX-1 and COX-2. So NSAIDs work by blocking the cyclooxygenase enzyme, so inhibit production of prostaglandins and thromboxane, which are produced as part of the inflammatory response. COX-1 is a constitutive enzyme repeatedly present in the tissues and is responsible for production of protective prostaglandin in the gastrointestinal tract and the kidney. So COX-1 is always present. That is what you need to know. The cyclooxygenase 1 is a constitutive enzyme that is always present within the tissue. Okay, it is already present within the tissue and is responsible for the production of protective prostaglandin within that gastrointestinal tissue or the kidneys. But when COX-2 is produced, this is this will come because there has been an assault to the tissue. Okay, it is inducible. Okay, so it's an inducible enzyme. So COX-2 enzyme, it's inducible, it's after an assault to a tissue. So there are enzymes which are formed during inflammation and pain. Okay, they are mainly present in the process of inflammation and are responsible for formation of prostanoids or prostacyclins, prostaglandins, and thromboxanes as part of the inflammatory response. So COX-2 inhibitors are used to relieve pain due to inflammation. Cyclooxygenase 2 inhibitors block cyclooxygenase 2 enzyme that promotes inflammation. Cyclooxygenase 2 enzyme converts arachidonic acid to prostaglandin, causing pain and inflammation. Okay, so that is in the normal way. But when we give the drug, it is going to inhibit this process so that less prostaglandin is produced or no prostaglandin is produced, so reduce the pain transmission, hence the analgesic effect. Acetylsalicylic acid or aspirin. Okay, the therapeutic use include anti-inflammatory effect. It reduces the vasodilator prostaglandin, that is E1 and E2, that results in reduced vasodilatation and edema. The uses may include as antioxidant property. It's a free radical scavenger. It may be used in rheumatoid arthritis and rheumatoid fever. Analgesic effect, use of aspirin, it reduces peripheral production of prostaglandin, thereby desensitizing the nerve endings to pain. It also reduces the production of prostaglandin centrally, thereby inhibiting pain stimulus at the subcortical site. Therapeutic uses used for mild to moderate pain secondary to inflammation. For instance, arthritis, dysmenorrhea, and postpartum pain. Antipyretic effect of salicylic acid or acetylsalicylic acid. It reduces the production of prostaglandin E2, which is generated in response to inflammatory pyogenes. Antiplatelet effect use of aspirin. It leads to irreversible inhibition of COX enzyme in platelet, leading to inhibition of thromboxane synthesis and platelet aggregation inhibition. It is used in the prophylaxis of transient ischemic attacks, myocardial infarction, and unstable angina. The dose of aspirin, it's available in 300 milligrams. Okay, so as anti-inflammatory, you can give 400 to 800 milligrams per day. As an analgesia, you can give 300 to 600 milligrams of PRN, and as an antiplatelet, you can give 75 milligrams to 150 milligrams. Okay, so this we give to prevent a stroke, so you can give as an antiplatelet. Okay, the side effects are NSAID are predisposed to peptic ulcers, renal failure, allergic reactions, and occasionally hearing loss. and they can increase the risk of hemorrhage by affecting platelet D function. The use of aspirin in children under 16 suffering from viral illness has been linked to Reiser syndrome, which is a rare but severe liver disorder. Okay, so now let us look at the profile of paracetamol. The exact mechanism of action of paracetamol or acetaminophen is uncertain, but appears to act centrally in the brain rather than peripherally in nerve endings like NSAIDs. So the route of administration, paracetamol is usually taken orally or rectally to relieve and reduce opioid consumption in the perioperative setting. The dose it is given per kg body weight in children, but for adults 500 to 1 gram 3 times a day it can be given. Adverse effect, paracetamol has few side effects and is regarded as generally a safe drug, although excess or sustained use can lead to potentially life-threatening liver damage and occasionally kidney damage. Okay, so now let us look at narcotics or opioids. Narcotic analgesia are drugs that relieve pain, can cause numbness, and induce a state of unconsciousness. Morphine and its analogs and some synthetic derivatives are grouped as narcotic analgesics. Narcotic analgesics are used to relieve acute, chronic, and severe pain. Some narcotics are more potent than others. They also have the tendency to cause tolerance and dependency. Narcotics here, mechanism of action. Narcotics, they act through the central receptors which are responsible for the respiratory depression, okay, for euphoria and analgesia. They work by binding to opioid receptors which are present in the central and the peripheral nervous system. Okay, there are three types of opioid receptors, which are all G protein linked and either facilitate opening of potassium channel causing hyperpolarization or inhibit calcium channel opening, so inhibit release of excitatory neurotransmitters such as substance P. Overall, narcotics analgesics reduce neuronal excitability in the pain-carrying pathway. Examples of opioid drugs are morphine, pethidine, codeine, and diamorphine. So here it's important that you know that when you give a narcotic, it has a three type of opioid receptors that it will work on, which are all G protein linked and either facilitate opening of potassium channel causing hyperpolarization or may inhibit channel calcium channel opening, so it will inhibit release of excitatory neurotransmitters or that of substance P. Opioid analgesia are a type of prescription drugs that are used for the medical purpose of relieving pain. When a person takes opioid analgesic outside of their medical use or in increasing dosage and frequency without talking to a doctor first, it becomes a prescription drug abuse. Opioid analgesics are used for people with chronic pain or pain after undergoing surgery. Opioid analgesics act on the brain by activating opioid receptors. By activating these receptors, opioid analgesics will increase the release of the neurotransmitter dopamine. The increase in dopamine causes the intense feeling of happiness and pleasure or euphoria that people feel when they use these drugs. Opioid analgesia also act on the brain by interfering with the transmission of pain, okay, messages to the brain. Okay, the therapeutic use, they are used like for codeine, they are used as cough suppressant, also used to treat moderate to severe pain, also used to reduce motility of gastrointestinal tract. Okay, so they may cause constipation. So short-term side effects of narcotics include The short-term effects of opioid painkillers use may include relaxation, drowsiness, itching, sweating, and dilated pupils. Others are vision problems, nausea, vomiting, and lack of concentration, constipation, anxiety, slowed breathing, fatigue, and decreased appetite. Okay, the long-term side effects of opioid painkiller may include depression, insomnia, tolerance, and death from respiratory depression. For drug abusers, may even because of needle exchange may lead to HIV or hepatitis. Okay, from injectable drug abusers, and also may affect pain threshold. So someone who have decreased pain threshold. Okay, so now let us look at the second group of drug, and the second group of drug that we are looking at is antibiotics. Okay, the first group of drug that we're looking at are analgesia, and we have discussed the two types of analgesia, that is narcotic and non-narcotics. Okay, we talked about narcotic drugs being morphine, pethidine, and codeine, and how they are used. Okay, then we also talked about NSAIDs drugs. Okay, we talked about paracetamol, that exceptionally is different from other non-narcotics because it does not have anti-inflammatory properties, but it has the analgesic effect, okay, and the antipyretic effect. Okay, then we also gave examples of non-steroidal anti-inflammatory drugs like aspirin. All right, so now let us look at antibiotics as another class of drugs that are used within the hospital. Okay, antibiotics, also known as antibacterial, are types of medication that destroy or slow down the growth of bacteria. The Greek word anti means against, and the Greek word bios means life, bacteria or a life form. So antibacterial. Okay, so anti against the biolife, bacterial life. Antibiotics are used to treat infection caused by bacteria. Their target mainly is the bacteria, and they are not effective against the fungi, parasites, and viruses. Okay, however, if antibiotics are overused or used incorrectly, there is a chance that the bacteria will become resistant, meaning the antibiotic becomes less effective against that type of bacterium. This is the reason why you have to learn about also the classification of antibiotics. Okay, so antibiotics are classified in two groups, namely bactericidal, killing, okay, bacteria, bactericidal. So these are antibiotics that kill the bacteria, suicide, side kill. Okay, static at the same point. So bacteriostatic, these are antibiotics that prevent the growth and multiplication of bacteria. So static, they will prevent the growth and multiplication of the bacteria to facilitate the engulfing of those bacteria. So there are so many antibiotics, and we will still discuss some, with our board lesson. Okay, so under main classification of the groups here, we have sulfonamides, penicillins, and tetracyclines, but we are going to learn in our board series different types of antibiotics and the point at which they work. So we are going just to look at a few antibiotics that we might find within the national formulary. Okay, so before selecting an antibiotic, you must consider the following: the patient and the known or likely causative organism. Okay, so when you are choosing an antibiotic, you need to know the patient, okay, and the organism of the cause of the disease. Okay, you may need to know the history of allergy, renal, and hepatic function. You also need to know the resistance of the drug to the infection, okay, then the severity of the illness, and ability to tolerate drugs by mouth. Okay, so the first group of antibiotics that we are looking at are penicillins. So they are bactericidal and act by interfering with bacterial wall synthesis. Okay, so they interfere with the bacteria so that it does not form the cell wall. If it does not form the cell wall, then the bacteria will die. So they diffuse well into body tissues and fluids, but penetration into cerebrospinal fluid is poor except when the meninges are inflamed. Penicillins are active against gram-positive organisms and gram-negative cocci. The following are types of penicillins. We have benzyl penicillin or Cristapen or penicillin G. Indication is given in tonsillitis, otitis media, streptococcal endocarditis, meningococcal, and pneumococcal meningitis. The doses you can give intramuscularly or IV for infusion, 600 to 1.2 grams daily in 2 to 4 divided doses. Of course, all these drugs we give according to the order by the physician. Okay, then in meningitis, you can give by slow intravenous or infusion 60 to 90 milligrams per kg body weight daily in 4 divided doses. For children, the doses may be similar, so you follow according to the pediatrician. But mostly it's given 20 to 40 milligrams per kg body weight in 4 divided doses. The side effects of penvine, or sorry, of benzylpenicillin, okay, include sensitivity reactions, including urticaria, fever, joint pains, anaphylactic shock in hypersensitivity patients, and then contraindication is for those that have penicillin hypersensitivity. Okay, so then we have this other type of penicillin, that is benzathine penicillin. Presentation injection of this one, penicillin, okay, is 475 milligrams, and then we have procaine penicillin, okay, 250 milligrams, and then we have benzylpenicillin, sodium of 300 milligrams. So that is in benethamine penicillin or triplo. Okay, so triplo, or that is, we have 3 types of drugs within this drug. So indication is a penicillin sensitive infection. It can be given by deep intramuscular injection, the contents of 1 vial every 2 to 3 days. Okay, then we have benzathine penicillin. Indication, penicillin sensitive infection, particularly this one is given in syphilis, rheumatic fever, as a prophylaxis. The dose, single dose of 2.4 mega units intramuscularly, rheumatic fever, prophylaxis of 1.2 mega units intramuscularly monthly. Side effects, caution in those contraindication as for benzylpenicillin or other penicillin for people who are hypersensitive to penicillin. Then we have phenoxymethylpenicillin. Phenoxymethylpenicillin is a PenV. Indication, mostly this one is given for upper respiratory tract infection. Okay, it's given for that, and also it can be given in tonsillitis, otitis media, and sinusitis. The doses are available in 250 to 500 milligrams and given 6 hourly. Side effects are more just like any other penicillin, hypersensitivity. Okay, then procaine penicillin, indication is penicillin sensitive infection, including syphilis and gas gangrene. Okay, adults, that is 600 milligrams 2 times daily. It's given also in syphilis. You can follow the algorithms there for managing syphilis. The side effect, same caution as for other penicillin. Then we have ampicillin. Ampicillin mostly is used for urinary tract infection. Okay, we are going to look at the antibiotic radar, and rather, and then we're going to see how these drugs can be placed. So it's important you know that ampicillin is mostly used for urinary tract infection, otitis media, chronic bronchitis, or invasive salmonellosis. The dose adults, it can be by oral 250 to 500 milligrams are given 4 times a day, okay, at least 30 minutes before food, and can also be given intramuscularly or IV. Side effects is rashes, diarrhea, and contraindication, so the caution or contraindication as for other penicillin to do with hypersensitivity to penicillin. Amoxicillin or amoxil is also similar to ampicillin. It is more active than ampicillin though. It's available in 250 milligrams and given 8 hourly. Okay, it can be given in peptic ulcers. Okay, it can be given respiratory tract infection. So similar to ampicillin, that is on side effects. Okay, then we have co-amoxiclav. Okay, so augmentin, amoxicillin, and clavulanic acid. So similar to ampicillin, okay, resistant strains of Staphylococcus aureus. Okay, so when you add the clavulanic acid, okay, it will enhance the work of amoxicillin. Okay, so it becomes more of a stronger drug to work against the resistant strains of Staphylococcus aureus, E. coli, Haemophilus influenza. Okay, so the dose 250 or 1.5 milligrams, 500 or 250 every 8 hourly per oral, and the side effect more the same like other penicillin. Then we have penicillinase resistant penicillins like cloxacillin, okay, or the other name that is obinin. So infections due to penicillinase are producing staphylococci. So for adults, you can give by mouth of 250 to 500, and it's given 8 hourly. So it's also available in intramuscular and IV injection. So child enrolled under 2 year quota, that is other adults, you can always calculate according to the doctor's order. As for benzopenicillin, an oral administration may produce diarrhea and pruritus, so the side effect also for this one is the same. Contraindication also include hypersensitivity. Okay, so now let us now look at another group of antibiotic. Okay, we have looked at the penicillins. So now another group of antibiotic is tetracyclines. Under tetracyclines, we have tetracycline as an example. We also have doxycycline as an example. So indication is exacerbation of chronic bronchitis, infection due to brucella, infection due to chlamydia, mycoplasma, and rickettsia, acne vulgaris, or cholera. Okay, so it can be given by mouth and it's available in 250 to 500 milligrams and can be given 6 hourly. Okay, side effects include nausea, vomiting, diarrhea, and superinfection with resistant organisms. Contraindication, that is in renal failure, in pregnancy, and not to be used in children under 12 years of age because it may cause dentition where there is coloring of dentition, the teeth just becomes yellow. Also, if the mother is breastfeeding, you might not to give because it can be placed in breast milk and it may affect the dentition of the baby. So breastfeeding, avoid giving with milk or calcium product as it will not be absorbed. Okay, it tends to form a crystal in the mouth, in the stomach. So doxycycline is an example of tetracycline. Okay, so the other name for doxycycline is vibramycin. Indication similar to tetracycline. Okay, it can also be used in treatment of sexually transmitted infection. Okay, so initials we have 200 milligrams, 50 milligrams are given as twice a daily. Side effects are similar to tetracycline. Contraindication are also similar to tetracycline because then we have another group of antibiotics known as aminoglycosides. Okay, we have another group of antibiotics known as aminoglycosides. The mechanism of action of aminoglycosides, these are rapidly bactericidal. Bacterial killing is concentration dependent, but residue bactericidal activity persists even after the serum concentration has fallen below the minimum inhibitory concentration. So the properties account for the efficacy of once daily dosing regimen. Aminoglycosides are potent bactericidal antibiotics that act by creating fissures in the outer membrane of the bacterial cell, resulting in leakage of intracellular content and enhanced antibiotic uptake. This rapid action at the outer membrane probably accounts for most of the bactericidal activity. They are particularly active against aerobic gram-negative bacteria and act synergistically against certain gram-positive organisms. Gentamicin is an example of an aminoglycoside and is the most commonly used drug, but amikamycin may be particularly effective against resistant organisms. Aminoglycosides are used in the treatment of severe infection of the abdomen and urinary tract, as well as bacteremia and endocarditis. They are also used for prophylaxis, especially against endocarditis. Okay, so gentamicin indication septicemia and neonatal sepsis, meningitis, and other central nervous system infections, biliary tract infection, acute pyelonephritis, or prostatitis, endocarditis. Okay, so these drugs, they are able to enhance the effect of, they have a synergistic effect. Okay, they enhance the effect of penicillin. So doses are average dose of 40 milligrams every 8 hours. Side effect: irreversible partial or total deafness and vestibular disturbances. So reversible kidney damage, infrequently papular and anemia and convulsion can be seen as some of the side effects of gentamicin. Caution for someone who has impaired renal function, so meaning you have to use with caution or do not use, or should not be used in combination with streptomycin. Okay, so now another aminoglycoside is streptomycin. Streptomycin is used for the treatment of certain unusual infections, usually in combination with other antimicrobial agents. Because it is less active than other members of the class against aerobic gram and negative roads, it has fallen into disuse. So streptomycin is used for the treatment of certain unusual infections, usually in combination with other antibacterial agents. May also be administered by deep intramuscular injection or intravenously. The dose of streptomycin is 15 milligrams per kg body weight daily for patients with creatinine clearance above 80 mL per minute. It typically is administered as a 1000 milligrams single daily dose or 500 milligrams twice daily. The daily dose should be reduced in proportion to creatinine clearance. For creatinine clearance, that is for creatinine clearance, okay, that is above 30 mL per minute. Amikamycin is also another example of aminoglycoside. The spectrum of antibacterial activity of amikamycin or amikin is the broadest of the group. Because of its resistance to many aminoglycoside inactivating enzymes, it has a special role in hospitals where gentamicin and tobramycin resistant organisms are prevalent. The recommended dose of amikamycin is 15 milligrams per kg body weight as a single daily dose or divided into 2 or 3 equal portions, which must be reduced for patients with renal failure. The drug is absorbed rapidly after intramuscular injection but is usually given intravenously. Neomycin. Okay, so neomycin is a broader spectrum antibiotic, a gram-negative species that are highly sensitive, like E. coli, Enterobacter, aerogenes, Klebsiella pneumoniae, and Proteus vulgaris. Gram-positive microorganisms that are inhibited include Streptococcus aureus and that is E. ficaris, Mycobacterium tuberculosis also is sensitive to neomycin. Also, strains of Pneumonia aeruginosa are resistant to neomycin. Then we have erythromycin. Okay, that is alternative to penicillin in penicillin-sensitive patients. That is sinusitis, diphtheria, and whooping cough as prophylaxis for Legionnaires disease. This drug can be given. Adult doses are available in 250 to 500 milligrams every 6 hours, up to 4 grams a daily in severe infection. Side effects include nausea, vomiting, diarrhea, and this may be seen mostly after large doses. Okay, so now we have quinolones. Quinolone is another group of antibiotics. These are fluorinated quinolones such as ciprofloxacin, Cipro, okay, moxifloxacin, Avelox, and gatifloxacin, Tequin, are orally effective for the treatment of a wide variety of infection or infectious diseases and have relatively few side effects. The mechanism of action of quinolones, here they target bacterial DNA gyrase and topoisomerase. Okay, for many gram-positive bacteria, topoisomerase is the primary target. For many gram-negative bacteria, uh, bacteria, DNA gyrase is the primary quinolone target, as illustrated in the figure here. Quinolone inhibits the so, so we're saying the fluoroquinolones are potent bactericidal agents. So okay, against a broad variety of microorganisms as outlined under therapeutic uses. So fluoroquinolone and quinolones are different types of antibiotics, okay, though sometimes they are discussed together. Otherwise, when you look at their structure, fluoroquinolones are different from quinolones. So fluoroquinolones have good activity against staphylococci, but not against methicillin-resistant strains. Okay, so ciprofloxacin, okay, the quinolone there, okay, many systemic infection, respiratory and urinary tract infection, bone and joint infection, it is used. The doses in which it is available include 250 to 750 milligrams. Side effects include nausea, diarrhea, rash, pruritus. Special precautions here, adequate food intake is necessary to avoid Crystoruria. Okay, so then another group of antibiotic that we also need to look out for is chloranthenicol. Okay, so chloranthenicol is a group of drug, and chloranthenicol is a drug that is found under chloramphenicals. So the indication include a typhoid fever, whooping cough, hemophilus infections, meningitis, and anaerobic infection. Of course, do not use for trivial infection because this is one of those powerful antibiotics that we have around. Adult 250 to 500 milligrams IM or orally every 6 hours can be given. Side effects include aplastic anemia, it has got bone suppression activity, okay, sensitization, gastrointestinal disturbances. Contraindication for chloramphenicol include the pregnancy to avoid a Graves syndrome, okay, baby Graves syndrome, breast feeding for mothers, and then active immunization. So here you need to note that there is a contraindication. Then the next group of drugs here under antibiotics is sulfonamides and trimethoprim. Okay, sulfonamides and trimethoprim combinations are used to prevent and treat infection. Sulfadiazine and trimethoprim combination is used to treat infections such as urinary tract infection, bronchitis, middle ear infection, and traveler's diarrhea. Okay, it is also used for the prevention and the treatment of pneumocystis carinii or cerevisiae pneumonia. However, in my geographical setting, sulfametazole and trimethoprim combination is strictly used in patients with HIV-related infection as it helps to slow down the progression of HIV infection before starting antiretroviral therapy. The regimens sometimes change this time. Okay, they just commence antiretroviral drugs and the Septrin can be given when the need has been assessed. Unless indicated, sulfonamides and trimethoprim combinations are indicated for invasive salmonellosis, typhoid fever, bone and joint infection, okay, or that may be due to Haemophilus influenza, urinary tract infections, sinusitis, okay, in gonorrhea, in chronic bronchitis, or in penicillin sensitive patients, and also can be used in chancroid. Dose by mouth, you can give 2 tablets, that is 960 milligrams every 12 hours. Side effects include nausea, vomiting, skin rashes, blood dyscrasia, reduction in renal and hepatic function. Contraindication of this in pregnancy, especially the first 3 months. Okay, infants under 6 weeks, severe hepatic or renal insufficiency. So these are drugs, sulfonamides, they are not given in the first 3 months. Okay, first trimester. Sulfonamide and trimethoprim combination are best taken with a full glass of water to help prevent some unwanted effects of these sulfonamides like renal stone formation. So you encourage the patient to take a lot of water. Okay, so then the other group of antibiotic that we need to look at is nitrofurantoin or fludarabine. Indication urinary tract infection. Okay, it's available in 50 to 150 milligrams. So nitrofurantoin, okay, it's a group of drugs, and we have nitrofurantoin as a drug given QID with food. Okay, side effects include polyneuropathy and desensitization. Contraindication, impaired renal function. Okay, so in the next part of the lesson, we'll start looking at, we'll also look at antiviral as the third group of drugs, because we are looking at 6 types of drugs. So we have discussed antibiotics, we have discussed different types of antibiotics, and in our board lessons, we are going to record the lesson where we talk about the antibiotic radar, and then we're also going to talk about where the mechanism of action and the groups of these antibiotics. So we are going to discuss that within our board lesson or tutorial. So in this comprehensive lesson, we have just discussed these types and some properties that we need to know about these drugs. So the next lesson will be about antiviral agents. Okay, so that will be the next lesson on the groups or classification of drugs. The simple understanding of this diagram is that here we have the virus. Okay, so the virus is attached to the cell wall. So this black line represents the cell wall of the host cell. Okay, then this capsid, okay, okay, during fusion is the one that is released inside the host cell. So this yellow part here is the capsid. Okay, so the capsid carries the DNA information, also the RNA information of the HIV virus. Okay, it carries the DNA material, okay, or the RNA material of the virus. So these will be released. So we have the HIV RNA. So when this HIV RNA has been released, with the help of the reverse transcriptase, okay, so this arrow is showing that with the help of reverse transcriptase, the HIV RNA will be converted into the HIV DNA, or it will be synthesized to come up with the HIV DNA. Okay, so this is a DNA component or material. So HIV, so the RNA is one strand, okay? So when a DNA material has been formed, it becomes double-stranded, okay? So we have the HIV double-stranded DNA material. So now when it reaches the nucleus, entering the nucleus, okay, when it enters the nucleus, so in the nucleus, that is where we have the host DNA, which is formed. So in the host nucleus, okay, of course, this black line is indicating the nucleus. So in the host nucleus, the double-stranded HIV DNA material is going to be incorporated to the host DNA, okay, using the enzyme integrase. So reverse transcriptase here changing the HIV RNA to a double-stranded HIV DNA. Okay, then we have integrase in the nucleus here, combining the new formed HIV DNA material into the host DNA. So when you look at this part here, okay, it's different from this host DNA material, which is the yellow, okay, in this representation. So there is insertion of the host into the host genome, okay, of this virus. So when this has been done, so this DNA material will be influenced to produce HIV messenger RNA. Okay. So when these HIV messenger RNA are produced, so we have these HIV messenger RNA. Okay, they will come out. Okay, and as they come out, they find other proteins within the cytoplasm. Okay, of other protein materials that are needed for the virus. So with the help of the protease enzyme, it is going to cut long HIV proteins, okay, into HIV precursor proteins. So here at the bottom of the cell, we have HIV longer proteins, okay, that come out from there. So when the protease enzyme works on these HIV proteins, it's going to cut them into smaller ones that are needed for the virus. Okay, so now the HIV RNA that has now been produced is going to assemble with the HIV precursor proteins here to form new virus. So when the new virus has been formed, then it buds out here, okay, as a new virus by acquiring an envelope. Okay, so that is how the HIV virus necessarily replicates. So when we are trying to block in pharmacology, okay, we bring in some inhibitors here to stop fusion or to stop attachment, okay? Or if here the virus has entered, we can use non-reverse transcriptase, nucleoside reverse transcriptase inhibitors. So here, so nucleoside is a protein material that is needed for DNA. So we can try to block this conversion of HIV RNA to HIV DNA. If we fail to block this, we can try within the nucleus to block the combination of HIV DNA material into the host DNA by building a drug known as an integrase inhibitor. Okay, so if it fails here, then we can also try to stop the proteins, the conversion of HIV long proteins into HIV precursor proteins by coming up with a protease inhibitor, okay, drug here, okay. So that is how now the virus, after being released here from the nucleus, it comes into the cytoplasm here of the cell. We have the precursor, then there is assembly, then there is a movement out of the or budding out of the virus. So that is how we should understand the steps here of the virus and also the pharmacological actions that are supposed to be done